I had a fairly active TB practice, and I was usually managing a few patients at any given time with active tuberculosis. But, San Diego is also, one of those kind of unique places where you have a wealthy region right next to a developing country. And so obviously, immigration from Latin America played a big role into our TB incidence in Southern California. But also, the other big countries were the Philippines, Nigeria, and Vietnam were kind of along with Mexico, were kind of the big four places where we saw a lot of folks with tuberculosis in SoCal. But beyond that, there is a certain incidence of locally acquired TB among U.S.-born people that we do have to be vigilant for. And one of the things I think we do, quite well in the military is active screening for it. Whenever we all come into initial military training, regardless of what pathway we do, there is screening for tuberculosis infection. And that, historically is with the PPD, with the skin test. So we have we're pretty good at identifying these folks and getting them on therapy early to prevent the progression to active disease. But it is still a big public health deal. And I think Kansas City reminds us that TB is not some thing that happens far off in the ether. It can happen at home.